Hi and welcome to another session with George Young Sports Rehabilitation. So today we're going to talk about plantar fasciitis, a syndrome in the foot that is caused by tension in the calf and of the tendons and ligaments in the foot itself. Most commonly affects people that do long distance running, those of us that like to wear heels, and also those of us that stand for long periods of time for work. It can affect you at the heel, at the base of the heel, but also along the arches of the feet and sometimes under the toes. So the first thing that I want to talk about really is the muscles that are affected or involved, to be more specific, within this syndrome. So I'm going to stand and you'll lose visual of my face. Okay, so first thing to be aware of is that your foot, predominantly most of the actions of the foot are instigated by muscles found in the shin and in the calf. So to bring your foot up towards your knee, you're using the tibialis anterior, and to bring your toes up you're using extensor hallucis longus and extensor digitalis. So those move the toes, the big toe and the rest of the digits. And then the opposite is true for plantar flexion, so coming up onto tiptoes. So here we're looking at tibialis posterior. We're also looking to bend the toes. We're looking at flexor hallucis longus and flexor digitalis. Okay, so that does those movements. And those are the dominant muscles within the foot. And the reason that they action the foot is they come down across the ankle and to the tops of the toes. Okay, so that's how they work. So heel pain at the base of the heel is often instigated by having very tight calves. And so to stretch the calf, we're going to start with a simple exercise where we bring the toe to the base of the heel. Just make sure you can see that properly. Okay, good. And then we're just literally bending down so that we're stretching the back of this leg here. Okay, so you should feel that stretching. The longer you hold it, the better the stretch will be. And you're looking for anywhere for 30 to 45 seconds for a decent stretch. Okay, and then you would swap legs. Okay, really important that your toe is touching your heel and that you're stretching the whole of that leg. Okay, so that's stretching that soleus muscle that is attached to the Achilles. And the Achilles comes down through the back of the heel here and attaches to the base of the calcaneus just here. And that's quite often why we get some heel pain. Now, if we're experiencing pain through the arch here, quite often that's caused by tibialis posterior, which does come through and supports that arch of the foot. And quite often this part of the arch gets tight because it collapses. Now, we're all renowned for wearing shoes that are quite flat these days, certainly girls and their pumps. And what that does is it doesn't really support the arch. So we're really looking for an arch support in our shoes. And if you do have pain within the arch, then I would recommend that you get yourself some insoles for your shoes. So a good test to see if your arch is involved is to grab your big toe and pull it up towards. Now you should be getting towards 90 degrees. So if you can't lift your toe off, you'll probably find that this is the main cause of your pain. And so I would definitely be advocating an instep. So you want to be able to lift that toe up. Okay, so if this arch is involved, how else can we support it? Well, we've got the arch in the foot, we can support with our shoes. But a great little exercise is to get a ball and to massage through the foot. Now, if you are a sufferer of plantar fascia pain, this was not comfortable, but it does actually help to really massage through those soft tissues and get some relaxation through there. If the ball is a bit intense and you think actually that's too painful, then I would recommend a foam roller. And the same thing, just sort of roll through those arches. Okay, so those are a couple of things that you could be doing. One thing that works well for patients is they can also use, instead of a foam roller, they could use a frozen bottle of water, and that would achieve the same thing. And as well as massaging it, it's cooling the area and relieving any tension. So those are some simple things that you can do to help alleviate any pain. Ice is your best friend and will help relieve any tissue pain and allow any swelling to calm down. So something that I have been doing now that I've been sat at a desk a little bit longer is this is now underneath my desk. I roll on this, so this is my footrest. I'm constantly rolling underneath my feet with this just to keep my feet nice and supple, because just sitting down, it also helps with pushing any fluid away from my ankles and reduces that kind of water retention around the feet and ankles as well. So I hope that's been useful. If you do want any further advice, or if you have pain that doesn't subside after a couple of weeks and you want to know how else you can help it, then get in touch at GY Sports UK, or you can find video footage here on YouTube, as well as email me at gysportsuk@gmail.com. Have a great day.